from the American Academy of Pediatrics.
Attention deficit and hyperactivity disorder, or ADHD, is very common. An estimated 7 million children in the U.S. live with the condition. But just because it's common, it doesn't mean it's not jarring to get this diagnosis for your child. Today, we're talking facts about the condition and how to support children who have it.
We often think of the symptoms of ADHD often starting quite early in life. And in fact, I work as a doctor often taking care of teenagers, and I'll often find out from teenagers who I'm diagnosing perhaps with ADHD for the first time at, say, age 12 or age 13, that actually these symptoms have gone on for a very long time. And in fact, to support the diagnosis of ADHD, we often expect that the symptoms have been present since a child was in their school-age years.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho-Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions and the answers will hopefully be even better. Let's get started. Today, I'm joined by my good friend, Dr. Scott Hadland, who is Chief of Adolescent Medicine at Massachusetts General Hospital. Scott, welcome.
Thank you so much for having me.
Scott, I can't think of a better person to have this conversation with, and I thought we could start with some basics about what ADHD is, and then we can transition to parenting and supporting kids with this condition, which is, I think, what many parents will be tuning in to hear about. So let's start at the beginning. What exactly is ADHD?
Well, it's right in the title, right? So you spelled it out earlier, attention deficit hyperactivity disorder. And I think each of those pieces is really important to consider. So there's an attention deficit in many kids, meaning that they have what we call inattention. They have a difficult time following instructions, paying attention in class, staying focused on tasks. Parents will often describe that they won't be able to sit still in one particular position and just focus and get something done. Hyperactivity is the idea that, parents will often describe their child as being driven by a motor or having lots of unending energy that is sort of, again, difficult to focus and to bring in. And, some kids will have more of the first thing, meaning that they have more inattention, and some kids will have more of the second, meaning they have more hyperactivity, and some kids will have both. I think it's also important to remember that the last word in ADHD is disorder, right? So the idea here is that there's actually some dysfunction that's happening because of these conditions. Look, we all know kids, and I have a couple of them at home who aren't always the best at paying attention and have a lot of energy. And what we're really focused on with ADHD is that we consider it to be a disorder because it's sort of beyond the pale. It impacts their ability to do well at school, at home, in their extracurricular activities. And typically, to clinch the diagnosis, what we want to do is make sure that we're observing these symptoms across a whole bunch of different settings. So not just at school, but at home and in extracurricular activities.
Yeah, which makes total sense. And yes, we all know kids who, quote unquote, don't listen, right? This is definitely different from that. Scott, I have to ask you, what causes ADHD? And I'm asking as a mom who suffers from eternal mom guilt. I want to know, Scott, is there anything I'm doing or not doing that is putting my little guy at risk?
Well, look, families of all different backgrounds and all different sort of resources can and often do struggle with a child who has ADHD. And this is a very common diagnosis, and it's one that really cuts across all different backgrounds, socioeconomic backgrounds, different parts of the country, different families with different genetics. And we think of ADHD as being sort of a multifactorial condition that has lots of different potential underlying contributors and causes. And it can be a mix of genes, environment, parenting, the particular context in which a young person is living and needs to thrive, right? So we know, for example, that classroom settings are not always easy for many kids. And yet, we often take the same sort of prescriptive classroom environment with, prototypically a teacher in front of a classroom teaching to a whole bunch of kids and apply it to every kid. And that's not necessarily the right learning environment for every child. And so it's important to remember that some component of this is also the world in which we expect kids to be thriving.
Which I think so many parents tell us, right? Like so many parents of kids with ADHD and kids who sometimes have struggles in school tell us this is just not working. This environment is not working. I definitely want to ask you more about schools and what we can do within school settings to help kids. But I do want to ask before we go there about early signs, Scott, and how are you supposed to tell them apart from just quote unquote typical kid behavior, as you were mentioning earlier?
Well, I think it can be really difficult for parents. And so as a first step, it's always a good idea to talk to your pediatrician about this. In fact, many pediatricians, including in our office and probably in yours and all across the country, are doing screening. When they see children at their annual physical exam, they'll do a screen to ask parents about the types of things that they're observing with their child. Are they observing that their child has a difficult time focusing? Are they observing that their child has a lot of energy that seems more than other kids, to try to understand, or is their child having some of these symptoms? And is it leading to some of the dysfunction that we talked about before? I think it can be difficult for parents to know what is normal, what is different. And so that's why involving, a professional and helping sort through that is often very helpful.
Yeah, Scott, and along the same lines, at what age can ADHD be formally diagnosed? I think, sometimes parents, pediatricians through screening tools and just parents knowing their child, right, have some suspicion that some of the symptoms that kids are exhibiting might be related to ADHD. But at what age can we actually tell? And what are the steps that go into making the diagnosis?
Yeah, these symptoms often will show up quite early in life. Parents will often say, I felt like he was struggling with this from, the age of 3 or the age of 4. He just always seemed to have a tough time focusing, or she always had more energy than the other kids starting at a very early age. So we often think of the symptoms of ADHD often starting quite early in life. And in fact, I work as a doctor often taking care of teenagers, and I'll often find out from teenagers who I'm diagnosing perhaps with ADHD for the first time at, say, age 12 or age 13, that actually these symptoms have gone on for a very long time. And in fact, to support the diagnosis of ADHD, we often expect that the symptoms have been present since a child was in their school age years. There are different cutoffs that are sometimes used in diagnosis, but I think it's really important for us as pediatricians, for us as parents, to think sort of really thoughtfully about this and sort of adhere to the general principle that these symptoms are often early presenting, meaning that they're often sort of present at a very early age in life.
Yeah, which makes absolute sense. Scott, how is ADHD different in boys versus girls?
We know based on the data that ADHD is more commonly diagnosed in boys than in girls, and that might be not necessarily because there are actual differences between boys and girls, but there might actually be differences in how ADHD presents in boys versus girls. Because of the society in which we live, boys who have behavior that is sort of viewed as disruptive often gets reported to parents or reported to teachers or observed by teachers and sort of directed into an assessment more quickly than girls. And so a worry that many people have is that ADHD is actually sometimes underdiagnosed in girls who may not sort of fit the typical stereotype that a boy who is misbehaving does in the society in which we live. And so for this reason, ADHD sometimes presents on average in younger ages in boys because it's sort of detected more early than it is in girls. And sometimes, again, is associated with more of this sort of disruptive behavior that can be difficult in a classroom for teachers as sort of the thing that leads a boy to get a diagnosis of ADHD. And, there are other ways that ADHD can sometimes present that are more subtle. So for example, again, without a lot of hyperactivity, but instead just more difficulties with concentration and focus, a child might actually be just having a difficult time completing their assignments or completing a test in the amount of time that's allotted. Or a girl might be sort of quietly disengaged at school or show some perfectionistic qualities that just result in her being unable to perform at the level that's expected in a classroom. And so sometimes these different presentations between boys and girls can result in them presenting at different times.
I also wanted to ask you, Scott, and I thought you'd be the perfect person to talk about this because you're also a dad. How would you explain to a child that they have ADHD? I imagine that when you talk to teens in your practice, you can pretty much go to the facts, right? And have a back and forth that's very thoughtful and thorough. But when you're talking to a smaller child, a school-age child, should we frame it as like, your brain is different, you have a superpower? Should we say all of our brains are different? What should we say, Scott?
I think it's important to know the child in front of you and know what is likely to be sort of compelling and motivating for them. I think it's really central and key that they understand that this is, not their fault, right? So any language that you use should be really free from blame. And I would really focus that conversation on, hey, we've come to understand that the way that you think about and process things is different from some other kids. You have something that we call ADHD. It's really common. A lot of kids have it. And so there's a certain set of things that we want to do to help to support you. And we're going to put those in place to help you to really be able to thrive.
Now, Scott, going back to the question about schools, right? Let's say that our child has been given a diagnosis of ADHD. What are some of the steps? What are some of the things that schools can do to support them?
Well, I think one thing that parents and schools often will sort of jump to is immediately thinking about medication. I think we've all heard of the different medications that are used to treat ADHD. Some of the brand names that listeners are probably familiar with include medications like Adderall or Ritalin. These are medications that are so commonly used for ADHD that they've almost become household names, right? And yet, even though our minds often go to medications, it's important to remember that for many kids with ADHD, simply making behavioral changes or sort of structural changes in the classroom can have an enormous impact. And so what I always recommend to families is to connect with the school early if you and your doctor are considering a diagnosis of ADHD, because simple things like making sure that kids who have ADHD are located closer to the front of the classroom so that there are fewer distractions around them and they have a better view of the board, that they're placed alongside peers that they aren't necessarily going to be distracted by, that when they're taking tests, they have a little bit more time to take their test, remembering the fact that because they have a difficult time focusing, they may need more time to complete tasks. And so a lot of these behavioral measures in and of themselves can actually address the issue with ADHD. This gets back to our earlier comment that ADHD is in many ways a mismatch between the way that a child learns and thrives and the environment in which we place them. And so by shaping the environment, sometimes we can make it a better match for the child.
Yeah, I love that way of thinking about it. Now, Scott, tell us about home. And just to be candid for a moment, right? Kids with ADHD struggle not just to pay attention and hold still, but also to follow instructions, all of which can be incredibly frustrating for parents. So say that we're really trying to help, we're trying not to yell, we're trying not to punish. What are some things that we can do?
I think one of the most important things is, first of all, to give yourself as a parent a lot of grace so that you can then give your child some grace, right? We have to remember that when we think about ADHD and so many other mental health conditions, when it comes to children, they are not intentional, right? These are the way that a child is sort of wired and not easy to change. If it were easy to change or to fix, then we wouldn't be having this conversation today, right? It would be a lot simpler than having an entire podcast on this. And so it's really important for parents to understand that their child's behavior is often not intentional and to give them time and space and exercise patience, recognizing that when you are providing structure to your child, when you're asking them to do things, when you're asking them to complete chores or complete homework or complete their piano lesson, whatever it is, that it's going to take time. It's going to take ongoing encouragement and ongoing reinforcement of the structure that you're putting in place. And it's going to take more work. And so giving yourself grace as a parent, understanding this is not intentional on behalf of the child, and showing them patience is really what's key.
Mm-hmm. Structure and patience, which is the name of the game in so much of parenting, right? Scott, let's talk about medications a little bit more. In my experience, there's still a lot of fear and stigma about starting an ADHD medication, some of which, of course, is understandable. Parents want to make sure that they're only doing things that are safe and that are necessary. I hear that word so much, necessary. Is this necessary? So talk to us, Scott, about the role of medications in the treatment of ADHD and about their safety.
Well, medications for ADHD are commonly used and they're very effective. Studies show that they really do improve children's ability to focus, to concentrate, and by doing so, often sort of addresses that hyperactivity that we talked about earlier on because you're sort of directing your energy into the task that you're supposed to be completing. And so they often do help children succeed at school, at home, in their extracurricular activities, and can be very effective. The most common medications that are used to treat ADHD are the stimulant medications, and they go by the generic name amphetamine salts, and that includes medications like, for example, Adderall, or methylphenidate medications, and those are medications like Ritalin. There are short-acting versions of these medications. We most commonly use what we call the long-acting versions of these medications, where often you're taking the medication in the morning and then it's lasting throughout much of the day and providing good coverage. The medications are very safe. They do have some side effects that we as pediatricians are often asking about. So some of the physical side effects include some patients might have a little bit of a stomach upset. They might have headaches when they take the medication. They might feel just sort of a little bit jittery, particularly if the dose has gone just like a little bit higher than maybe where they should be. So those are some of the physical side effects. We also are on the lookout for some of the mental side effects, and probably the most important ones to think about are insomnia, particularly if a child takes their medication too late in the day, they might have trouble sleeping that night. But even doses in the morning can sometimes cause that. And then decrease in appetite. And so we as pediatricians are always keeping an eye on, are children still eating well? Do they have enough appetite? Are they still growing? And so these are things that we're always watching out for.
No, absolutely. And I think in my experience, Scott, and I wonder what you have found in discussing with families, it really helps to just have an honest conversation about what we're looking for and what we're going to do if we see those side effects, right? We're really trialing something to see if it helps, right? And at the same time, monitoring for some of those things. If we're able to get this medication to help, in addition to some of the other things that you talked about at school, at home, and extracurricular activities, and we're able to avoid some of those side effects or manage them, right? Sometimes the loss of appetite, if we eat small meals throughout the day, we can sort of manage it, and we're getting a benefit in school, then overall, this is a net positive for that family. I wonder how you sort of prepare parents for some of this.
I have exactly the same kind of conversation that you alluded to. And when we're treating for ADHD, first of all, we're following up with families very closely because we are using medications that are controlled substances. And that really sort of behooves us as doctors to be meeting with families and constantly reassessing the benefits and the potential downsides of a medication, right? So we're meeting with families and asking, what are the benefits that you are noticing at home? What are teachers telling you about what's going on at school? And by the way, we sometimes use specialized forms that we call Vanderbilt forms to have parents and teachers each fill out paperwork that kind of just surveys what's going on and what behavior changes they're seeing in their child. But bottom line, constantly reassessing, are the medications working? And then weighing that benefit against maybe some of the downsides of some of these side effects if families are noticing them or experiencing them. And throughout, we all have the principle as pediatricians of using the lowest dose needed to get the best benefit that we can.
Absolutely. Scott, as we come to the end of our show, we do like to end with what we call a parenting prescription. I think for this one, I'll ask you this. What is one thing you wish everyone understood about ADHD?
I'd love to focus my parenting prescription on a very common question that I hear from families, and that is, are these medications addictive? And this comes up all the time, especially with teenagers. And I have a lot of families who tell me, he's tried vaping before, or, she's tried alcohol before. And so I don't want to give her a medication that is addictive. And it is true that ADHD medications, particularly among college students and older adolescents, do have the potential to be used in ways that doctors don't intend them. But it's also really important for parents to understand that these medications can be safely prescribed. And in fact, in young people who have ADHD, when that ADHD isn't treated, that's a risk factor for substance use and a risk factor for developing problems related to addiction. And in fact, when we treat ADHD, including with a stimulant when it's needed, we actually likely are decreasing the risk that somebody will go on to have impulsiveness or to experiment with substances. And so actually treatment with these medications that people are often worried about probably reduces the risk of addiction.
Scott, I am so glad you brought up that point, because at the end of the day, what we want is our kids, our teens to be safe. And it is so important to remember that what we do to treat ADHD can help us in that. So thank you so much, Dr. Scott Hadland, for joining us today.
Thank you for having me.
And thank you at home for joining us. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on YouTube, Instagram, Facebook, and Threads at Healthy Children AAP, and be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Laura Alessio,
Catherine Beard,
Garrett Brown,
Zach Christman,
Ann Johnsos, Kathy Jewell,
Claire Keating,
Doug Nagel,
Jackie Ortega, Susan Stevens Martin,
Mary Claire Walsh,
Hannah Weston.
And our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bracho-Sanchez. Thanks for listening.